Iron deficiency anemia occurs when a lack of iron in the body prevents the production of enough hemoglobin for red blood cells. This deprives the body's tissues of necessary oxygen. It is defined as a decrease in hemoglobin concentration in the blood below the normal range. It is also defined as a reduction in the number of circulating RBCs and a reduction in the packed cell volume. What are the basic reasons or etiologic factors for iron deficiency anemia? First is the increased blood loss. This increased blood loss could be because of many reasons, some of which are increased menstrual bleeding or menorrhagia or at times or during some surgical procedures. Post-surgery. When there is malnutrition, then or when there is inadequate dietary intake of iron, then it could result in iron deficiency anemia. When the demand for iron is more, even then it could result in anemia, as in case of pregnancies. And when there are some decreased absorption, and when there are some gastrointestinal tract related reasons, it can lead to decreased absorption. And anemia in children could be mainly because of malnutrition or hookworm infestations. The symptoms of iron deficiency anemia include fatigue, pale skin, dizziness, headache, insomnia, oral burning, brittle nails, loss of hair, coldness of extremities, palpitations, weakness, and breathlessness. Oral manifestations include mucosal pallor, depapillation of bald tongue, burning sensation, angular cheilitis, and a chronic iron deficiency anemia can lead to Plummer-Wilson syndrome. Plummer-Wilson syndrome is also called as Patterson-Kelly syndrome, characterized by iron deficiency, spoon-shaped nails or koilonychia with esophageal webbing and upper esophageal strictures. The etiopathogenesis is that it results in increase in the free radical stress, causing DNA damage, and sometimes can result in malignant transformation. Plummer-Wilson syndrome is a pre-malignant condition. Laboratory investigations include evaluation of the hemoglobin level, peripheral smear, which shows microcytic hypochromic anemia, decreased MCV, MCH, MCHC, increased total iron binding capacity, decreased serum iron, and decreased serum ferritin. Treatment mainly involves oral and parenteral iron therapy, depending upon the demand. Oral iron is around 200 to 400 milligrams for 3 to 6 months. Parenteral iron therapy includes iron dextrin, iron sucrose, iron sorbitol citric acid complex, and iron sodium gluconate complex. Basically, when there is a reduction in the hemoglobin concentration, the rheologic balance between the cells between the blood cells changes, which results in a change in the entire dynamics of blood flow, and hence elective procedures should not be performed if a patient has marked anemia, which might result in severe bleeding otherwise. General anesthesia should also not be administered unless the hemoglobin is at least 10 grams per dl. there could be an increased risk of ischemic heart disease in patients with chronic long-standing anemia. Thank you.